Hi, I am Sarah Hender-Guevara, and I present the implementation of Speak Up About Your Care into the bedside nursing workflow for course NUR 456 at ACPI University. The Speak Up About Your Care project aimed to incorporate a communication tool into the workflow of bedside nursing staff to enhance patient safety, satisfaction, and collaboration between patients, families, and the care team on a medical surgical floor. The project involved phases of research, education, implementation, and data collection. Through collaboration with management and staff, a test of change plan was developed and executed, leading to 100% compliance with the Speak Up conversation within 2 weeks. Data analysis of quizzes and surveys indicated high staff knowledge and mixed perceptions regarding the ease of incorporating Speak Up into workflow, emphasizing the importance of ongoing support and training. Despite challenges, effective teamwork and collaboration were key to achieving project goals, leading to the expansion of the initiative to other units in the hospital. My role as a BSN student in this project was multifaceted and integral to the success of Phase 2. As a BSN student, I served as a liaison between the nursing staff and management, facilitating communication and collaboration throughout the project. I conducted research and data collection, reviewed literature on the Speak Up About Your Care communication tool, and conducted interviews to gather input from nursing staff regarding barriers to its implementation. Additionally, I contributed to the development and implementation of strategies to integrate Speak Up into the bedside nursing workflow, including the creation of a compliance tool and education sessions for staff. I actively participated in staff education sessions, providing support and guidance to nursing staff as they incorporated Speak Up conversations into their patient interactions. Furthermore, I played a crucial role in data analysis, creating a quiz and survey and then using Excel spreadsheets to analyze the results, identify trends, and provide insights for improvement. Overall, I aimed to demonstrate a commitment to lifelong learning, teamwork, and the advancement of patient safety and satisfaction within the healthcare setting. The primary goal of this project was to successfully incorporate Speak Up About Your Care into bedside nursing's workflow with every patient, every shift, 100% of the time for at least 2 weeks. To accomplish this, the following objectives were established: the development of an approved communication tool, implementation of the communication tool, data collection on staff knowledge, experience, and compliance, and assist with ongoing staff education. Communication tools that were used in the project included scripted dialogues, focused talking points, and a standardized communication method utilizing the Speak Up poster, and ongoing education sessions. These tools aimed to empower bedside nursing staff to initiate conversations using the Speak Up communication method, ensuring that patients felt heard, safe, and involved in their care decisions. The compliance tracking tools used in the project included a calendar-based tally system and a central assignment whiteboard with a designated Speak Up column. Bedside nurses would check off each patient they had the Speak Up conversation with during their shift, with any missing checks prompting follow-up by charge nurses or assistant nurse managers to address potential barriers to compliance. The quiz assessed bedside nursing staff's knowledge about Speak Up About Your Care, consisting of 5 questions aimed at gauging comprehension and understanding. The survey, administered alongside the quiz, solicited feedback on staff's experience with the Speak Up conversation, utilizing a Likert scale to gauge agreement with statements regarding its effectiveness in patient communication and workflow integration. Ongoing staff education efforts included structured training sessions to familiarize bedside nursing staff with the initiative and practice the conversation using a scripted dialogue and focused talking points. Education was reinforced through regular huddle discussions, where staff received updates on the initiative's progress, reviewed compliance goals, and discussed any challenges or barriers encountered during the implementation. Materials included educational templates, a case study, and feedback sessions aimed at promoting staff buy-in and ensuring consistent understanding and application of the communication tool. A few significant strategies of the project and their associated evidence include: strategy number 1, literature review and evidence-based practice. The project involved a thorough review of peer-reviewed literature on the Speak Up About Your Care communication tool, demonstrating a commitment to evidence-based practice. For example, I reviewed 18 articles that analyzed the importance of patient and staff communication in improving safety and satisfaction, articles significant to the project. Strategy number 2, collaborative education and training. The project involved collaborative efforts with nursing leadership to develop and implement an education plan for staff. By engaging unit managers, mentors, and charge nurses, the project ensured comprehensive training and support for all staff members. The involvement of management and mentorship was evident in decisions such as finalizing the quiz and survey and organizing educational materials, which supported research conducted by McKnight and Moore, 2022. Strategy number 3. The project utilized a test of change plan, or PDSA plan, to assess, implement, and refine strategies for integrating Speak Up About Your Care into daily practice. By establishing clear objectives and regularly evaluating outcomes, the project fostered a culture of continuous improvement. This approach aligns with the principles of quality improvement in healthcare as described by Ogrink et al. 2021. Strategy number 4. Throughout the project, data from compliance rates and surveys were analyzed to inform decision making. For instance, management's decision to expand the Speak Up initiative to other units in the hospital was based on the success of Phase 2 and increased patient satisfaction scores from recent HCAP-Press-Ganey surveys, an outcome specific to management's objectives. This exemplifies the project's commitment to using data to drive organizational change. Taylor et al., 2020. Specific outcomes for this nursing unit include 100% compliance with Speak Up conversation implementation, improved communication between nursing staff, and expansion of the Speak Up initiative to other units in the hospital. The achievement of 100% compliance with Speak Up conversation implementation signifies that every bedside nursing staff member consistently integrated the Speak Up conversation into their patient interactions, ensuring that patients were empowered to communicate their needs effectively and contributing to enhanced patient safety and satisfaction. Although not part of the goals of the initiative through the BSN lens, results from the management's findings warrant mentioning as they contributed to the final outcome noted within this project. Recent HCAP-Press-Ganey scores obtained after the completion of Phase 2 indicate an increase in patient satisfaction from 85% to 98%. Due to the success of Phase 2 and this increase in patient satisfaction, the facility's leadership decided to implement the Speak Up initiative in other units of this hospital, Mother-Baby/OB, and the emergency department. This expansion demonstrates the effectiveness and impact of the Speak Up initiative in improving communication and patient satisfaction, leading to its adoption as a standard practice throughout the hospital. Long-term application of the Speak Up initiative in practice involves its integration as a standard communication tool across various units in the hospital. Based on findings from data analysis, staff continue to have the Speak Up conversation 60% of the time since the completion of Phase 2. Ongoing staff education to ensure familiarity and proficiency with the initiative, regular monitoring of compliance, and providing support to address any challenges encountered will support Speak Up's long-term integration into the workflow of bedside nursing. Data analysis of the quiz and survey demonstrated a Speak Up knowledge of 98% and that 100% of staff agreed and somewhat agreed to Speak Up experience questions. This project provided an opportunity for personal growth and reflection, particularly in recognizing the importance of teamwork, collaboration, and ongoing education in healthcare. It allowed for introspection on the challenges faced and the satisfaction derived from contributing to positive outcomes in patient care. Through the project, I gained valuable experience in fostering teamwork and collaboration among interdisciplinary healthcare team members, especially in facilitating education for travel and float staff and planting seeds for the initiative's expansion across the organization. This involved effective communication, coordination, and support with staff from multiple departments to ensure the successful implementation of the Speak Up initiative on this medical surgical unit, leading to improved patient safety and satisfaction. The project facilitated the application of educational knowledge acquired during academic studies to address real-world challenges in healthcare. It provided an opportunity to translate theoretical concepts into practical solutions, demonstrating the relevance and impact of educational training in improving patient care outcomes. By implementing the Speak Up initiative, the project contributed to enhancing patient safety and satisfaction by promoting open communication, empowering patients to voice their concerns, and fostering a culture of transparency and collaboration within the healthcare team. This ultimately led to better patient experiences and improved quality of care. Thank you for watching, and I wish you success as you integrate Speak Up into your bedside nursing workflow for enhanced patient safety and satisfaction.